but I'm going to tell you a little bit more. I'm a natural medicine doctor, but I'm a fancy kind. So what that means is I have both the conventional medical training and the training in natural therapies. My board specialty, meaning what I am an expert in, is on the interaction between drugs, natural therapy, surgery, radiation, specifically in a cancer population. So my job is for people who are in treatment to help them to prevent side effects from chemotherapy, radiation, surgery, and once they're out of treatment, to help them to lower their risk of recurrence and recover and prevent side effects from treatment. Does that make sense to everybody? And then there's a significant population, part of our population, who have family members who have had cancer or who are concerned about their risk of cancer, and our job is to prevent. Okay? We have oncology specialists, nutritionists on staff, although I know a lot about nutrition. Hi, my friend, there's a seat up here if you want it. We have mental health therapists on staff. We have physical therapy. We partner with salons like Margot's and working with oncology-based esthetician or oncology-trained estheticians who can help you look your best. Before we get started, I want to ask, first of all, does anybody have any questions about me? All right. So let's start with prevention. So let's start from the beginning. This is before we get cancer or when we're in survivorship. What we need to do, what we have to do, and what we can do. So most of the data is actually around exercise and diet. So this is something I'm just going to be very broad with, and I want you all to just kind of jump in and ask me specific questions if it's not applicable to you. And please use your brochure or paper. If we have pens, Emery, maybe we could give them out if you want to take some notes, okay? Okay, so one of the things that we absolutely must do, and I want to start with diet, because a lot of the data is around diet. Diet, food we think of as being benign, but actually food is some of the most powerful medicine that we have. You know, it struck me last night. I was at an event for Carmanos, honoring some heroes in cancer care. And it was sad to me because I think a lot of people don't really understand that cancer today and these high rates that we're seeing of cancer in younger ages, high rates of recurrence, cancer in people before age 60, a lot of that we're seeing because of the changes in our food, the changes in our soil, and the changes in our environment. So prevention really starts with being very deliberate about the choices that you're making in terms of the foods that you're eating. Okay? So when we're talking about a cancer-fighting diet, we're talking about a couple things. We're talking about making sure that the foods that you eat are whole foods. So as far away from processed as we can get. Now everything is processed, meaning this date that you had to put, she has beautifully prepared with some rosemary on this plate. It had to be put in a container, right? It had to be washed, it had to be dressed, it had to be maybe sprayed with something to preserve it, I'm not sure. But it was processed in some way. So all of our food is somewhat processed. If the noise of the receptionist is bothering you, just come up here, dear, okay? All of our food is processed in some way. We want to avoid as much processing as we can. Meaning, think to yourself, how many steps did we have to go to get this date from the tree to the plate? That's what you need to be thinking. So if there's multiple steps to get there, it's not a whole food. Does that make sense to everybody? Good. So then is a cracker, a whole grain cracker from Whole Foods, a whole food? No, exactly. A crispy carbohydrate like a cracker is not a whole food. It's dressed up to look like a whole food. It says whole grain on the box, right? It says natural on the box. It says organic on the box, but it's not actually a whole food because crackers don't grow on trees, nor can we dig them out of the ground. Does that make sense? So if we can dig it out of the ground, or we can kill it and eat it, or we can pull it from a tree, then it is a whole food. And so you want to aim to keep your food as whole as possible. Butter, a whole food. It's not a whole food. Is it a real food? Yes, it is a real food. What makes it a real food? You're nodding your head, my friend. What's your name?
Cindy.
Hi, Cindy. What makes it a real food?
It's got real ingredients.
That's right. So
You
butter
can
comes
pronounce them.
yes. So butter is not as processed as other kinds of foods, right? It comes from, originally from a cow, right? And it's churned and made into a something that can be spread, right? Is Earth Balance a real food? So Earth Balance is like a vegetarian or vegan butter. So a lot of times people think, well, I need to be vegan, or I need to be vegetarian, right? There's some truth in that, but really what's most important is that what you're eating is real and as whole as possible. Now, Tom, you shook your head no when I asked if butter, oh, you just were shaking your head at me. Like, no, don't tell me about butter. I can't believe it's not butter a real food. No, because I can't believe it's not butter. It's not, right? It's not. So that's some of the misinformation that's out there, especially when you're looking at things on the news or in magazines. You're going to hear such and such is bad for your heart, or such and such causes diabetes. There is no food that causes diabetes. There's no whole food that causes diabetes. Rice doesn't cause diabetes. Banana doesn't cause diabetes. Watermelon doesn't cause diabetes. It's how we're processing that food that causes cancer, diabetes, or heart disease. Now, why would that be? Does anybody know why, or can guess why?
Process.
Because it's processed. And what's your name, my friend?
Sandra.
That's right, Sandra, my beautiful Sandra. So it's because it's processed, but it's a little more than that. It's because processed foods actually cause inflammation. So inflammation is the root cause behind cancer, autoimmune disease, and metabolic diseases. So all of the things that we die from in this country, except for car accidents, the root cause behind them is inflammation. So when we're thinking about what are the top 5 or what are the most important things to do, we're thinking about how to lower inflammation in our system overall, right? Processed foods cause inflammation because in order to process them, we need chemicals. And the more chemical exposure we have, the higher the level of inflammation in our bodies. Does that make sense to everybody? Okay, good. The next piece of a cancer-fighting diet is to make sure your diet shifts away from saturated fat animal products towards vegetables and fruits, so plant-based products. And by shift, I mean that normally if I go to Papa Joe's tonight for dinner and I buy some and I get a meal, I'm going to get a little side of broccoli, right? And then a big plate of meat and something else, right? Maybe meat and bread. It really should be switched. 75% of your plate should be fruits and vegetables, and 25% should be some sort of protein. Now, Denise, especially with lymphoma leukemia, there's a dense amount of data that high fruits and vegetables or a high antioxidant diet actually is preventative with lymphoma leukemia. She will not have a recurrence of lymphoma. That's not something you have to worry about. But because she probably had to have radiation, right?
Oh, but she did have
RCHOP. So did she have RCHOP or EPOS?
RCHOP.
Did she have a series of chemotherapy medications together?
There were 3.
3, okay.
There were 3 chemos. And,
So typically with those combinations, ACT maybe. Typically with those combinations, we don't see long-term side effects except to the kidneys and the heart. But with young people with lymphoma and leukemia, she's not likely to recur. It's more those of us who are older who end up with breast, colorectal, ovarian, where we see some recurrence issues, right? But a diet that's high in fruits and vegetables is absolutely protective almost across the board, particularly with colorectal, particularly with breast. Now, with ovarian cancer, the data isn't as strong with recurrence after the fact. However, there is very strong data, it wasn't Shirley, it was Lynn. There was very strong data, Lynn, that vegetarians who got ovarian cancer had a less aggressive disease and a lower rate of recurrence, meaning if they were vegetarian for 10 to 15 years prior to diagnosis. So we can extrapolate that data to say what you're eating actually changes the way your cell responds to the world around you, even to the drugs you get when you do get cancer. So we shouldn't take that lightly. Does that make sense to everybody? Good. So when we talk about fruits and vegetables, any questions there about fruits and vegetables? Yes, Denise.
So I try to do organic as much as I can. I try to do organic as much as I can. But if it came between, I went somewhere, and the organic and there's got to be a difference with fruit, right? Between berries and maybe a nectarine. But would I be better off to get the organic berries from Mexico or just the regular blueberries from Michigan?
That's a really good question. So she wants to know, Denise wants to know, would I be better off when I'm choosing between fruits to get the berries from Mexico or the locally grown berries from Michigan? And I'm assuming she's asking that because the berries from Mexico were labeled organic and the berries from Michigan were not. Is that right? Okay. It's a hard question. You should aim for organic when possible. However, 40% of organically labeled foods are not actually organic. So you're taking a risk either way when you buy a product. Plus, an organic farm can be next to a non-organic farm, and the wind doesn't care. So if I'm using pesticides in a non-organic farm, right, it can carry those pesticides into an organic farm. So to some extent, your fruits and vegetables are always suspect. Local growers who are sourced out of smaller markets or farmers markets don't tend to have the money to label organic, but actually have a higher quality standard with their fruits and vegetables. So if I was in that situation, I would get the local blueberries, but I would soak them in white vinegar for 20 minutes or wash them with soap and water to remove the pesticides. Does that make sense to everybody? Okay, good. Now all of you, please ask as many questions as you want. She's not monopolizing. This is what I want you guys to do.
Everybody's probably writing everything into something.
Because in fact, this is what will make it so useful for you guys if you feel comfortable, like Denise says. And the reason she feels so comfortable is because she's been here before. She's done this before. Okay, good.
So if
Let
I
me
get
just finish that choice, that question, and then I'll come to you. So I actually take all of my fruits and vegetables and put them in something with water and soak them with a capful of white vinegar when I get home. Then just shake them dry and put them in the refrigerator. It's easier than do it every time that you have to make something. Denise.
So let's say if I went somewhere, and would I be better off not to eat it if it's not organic, or to eat it anyway even if it had pesticides? And
So that's a great question. So let's say I went somewhere and somebody gave me vegetables, that were non-organic. Am I better off to eat them? It depends on how long it's going to be before you eat again. So if it's all you have to eat, you're on a 24-hour flight, you should eat the vegetables. Because in terms of the choices of foods you have, those are the better choices. Now why? Why are fruits and vegetables protective? Does anybody know?
Do they alkalize the vegetables, green vegetables?
Do they alkalize our
Not
tissues?
the fruit, but I meant the vegetables.
Do they alkalize our tissues, Denise wants to know. Could that be a part of why? Perhaps. What do other people think?
I think it's kind of easy on your digestive system.
So Sandra's saying that maybe they're more available to us because they're easier for us to digest. Anybody else?
Built-in antioxidants in fruits and vegetables.
Great. So Anne-Marie is pointing out that there's antioxidants in fruits and vegetables. So Anne-Marie has seen me speak before, and she had the right answer. Antioxidants are the most, in any fruit or vegetable that has a brightly colored skin, antioxidants are dense in those. And antioxidant simply means when I'm standing here in the world and I'm breathing the air, and this is a beautiful, healthy space, obviously. However, we do have carpet, we do have paint on the walls, we live in the world where people are driving by. I'm breathing in and I'm exposed to air particles that are actually causing oxidative stress to my cells. What does that mean? They're increasing inflammation. That's all that means, okay? They're increasing inflammation. Antioxidants combat that oxidative stress by partnering oxygen to another oxygen and stabilizing it so that the inflammation is quenched or stopped. So eating fruits and vegetables in high amounts actually has a very powerful anti-inflammatory effect. Does that make sense to everybody? Okay, good. And then the question about alkalization and the question about digestion is very important. How many people have heard about alkaline water, alkalization, and cancer? So quite a few of you. Okay. So it is true, cancer cells do not grow as well in an alkaline environment, meaning a basic environment. They grow very well in an acidic environment. So people believe that if you eat fruits and vegetables, it can alkalize your tissues, and that's true. Drinking alkaline water, though, doesn't make a difference. And chemotherapy, in part, works by alkalizing your tissues, okay? And then the question about digestion. Are fruits and vegetables easier for us to digest? Sometimes they can be.
Right.
You know, in fact, Sandra, it's best to lightly cook or lightly steam your vegetables. Raw vegetables are not as easily available to you, and you don't actually digest the nutrients or get that antioxidant benefit the way you would if they were lightly steamed or cooked. Now, I love Try It Raw and the other restaurants around here that give raw food, but I will say that in terms of from a cancer fighting perspective, it's not as helpful for you as maybe like a bean soup with some roasted root vegetables. Does that make sense to everybody? Okay, good, good. Any other questions about fruits and vegetables in the back
I
there?
have a question.
Yes. What was your name again?
Michelle.
Oh, yes,
They call
Michelle.
For the vegetables.
Do you want to sit over here, ladies? Just so that we can see you in the camera and I don't have to scooch over that way. It looks like they're behind the curtain. Go ahead, Michelle.
So it's actually like sometimes it's in the plant already. So how it's not like you can wash it off. It's in the plant already.
So Michelle wants to know, do pesticides get absorbed into the plant itself? And can you really wash off the pesticides? Yes, pesticides don't actually usually get absorbed. They're on the skin itself because their whole job is to prevent other critters from eating your food. That's it. So if we didn't have pesticides, nobody would be able to sell any fruits and vegetables because all the other critters that need to eat them would eat them all up. Or you'd have to be happy with getting some wormy apples, which is fine for you, but most people are not. Sandra's made a very bad face. Most people don't want wormy apples. But then we have to think about the consequences, right? The chemical is almost like putting makeup on the fruit, right? It's just to make it look good and avoid anybody else from eating it. Now, that doesn't mean that your fruit and vegetables can't be changed by genetically modifying them. That's very different from pesticides.
And also they put chemicals so that the plant can grow quicker.
So what Michelle is talking about is modifying our food so it looks better and so it grows faster and it grows hardier and it's less resistant to pesticides. So that's what genetic modification is. It was considered this amazing technology when it came out because these scientists basically engineered the DNA of, let's say, an apple in a lab so it would be completely resistant to wind, drought, hurricanes, plagues, you name it, right? So it's not really a God-derived or a natural-derived fruit anymore, per se. It's a fruit that's been modified by man to prevent it from being damaged. The question is, do GMO or do engineered foods have an impact on whether or not we're getting cancer or not? We don't know, but they are illegal in Europe. And they are supposed to be labeled in other countries. In this is the only country where we don't have to label a food as genetically modified. And we are seeing that some types of modification does increase rates of pediatric cancers, because we've had enough time to see those. And some forms of pesticide significantly change the way we're seeing spectrum diseases in our young children. Okay? Good question, Michelle. Okay, any other questions about fruits and vegetables? Now, Sandra.
What if you peel them?
What if you peel them, Sandra wants to know.
So the nutrients go away.
You can peel them, but when you peel them, you lose some nutrients, and also you can get pesticides on your hands, and pesticides are absorbed through the skin. They're stored in our fat tissues. We all have fat, hopefully in the right places, right? And that fat stores those pesticides, okay? Good questions. I want to give everybody a quick break because we have such a beautiful spread here. Does anybody want to get up and grab something for just a minute? Nope, want to keep going? Okay. Okay. Now it's very bitter. Berry powder is very bitter. You may think it's sweet, but it's not actually. It's very bitter. So you're going to need to put it in a shake of some sort or mix it in with other things like oatmeal.
What was it called?
Acai, A-C-A-I, or you could get a blueberry powder. That's also effective. So, and when you get it, Lynn, and you open the bag, you're going to see it's the most dark pigmented thing. It looks like, and it really you should think of it as gold. It looks like purple gold. It's just beautiful. And think about how effective that can be, that pigment, as an antioxidant. Okay, good. I want to point out that and most of us are older, except for a couple of people here, so we may not really be having children yet, right, or at all. But for those of us who are having children or thinking about our own kids who are going to be having children, what we eat now actually does have an impact on our children's rate of cancer. So if we start eating well 6 months before we start considering having children, you can change the quality of your egg and the quality of your sperm and the DNA that you're passing on to your children. So it's very, very important and very powerful what we eat. Okay, the next piece of a cancer-fighting diet, is to eat less. So I know that's a very hard ask, right, for all of us. But you remember, my friend, back in the 50s, plates were much smaller, right? If you inherited your grandmother's china set, it was very small, right? When you went to a restaurant, portions were much smaller. I went to the Detroit Opera House a couple of years ago, and I could barely fit my butt into the seat. And I have a nice butt, but I couldn't get in there because it was built when? In the 50s or somewhere around then, right? So we have changed. We have changed how we think about food. We've changed how we think about portion control. So the best way to do this is just to get a smaller plate. It's very hard to ask yourself to eat less. But if you start using a smaller plate, or you start using a bowl and use the one bowl method to eat, like these little plates that, sorry, what's your name, dear? Who's walking around with that plate? Can you turn around and show them? If that was the size of your dinner plate, that reduces the size of your portion by 25%. And that's a really excellent size for a dinner plate, okay? And that dinner plate should be 75% vegetables. Now, if it's hard to get there, just go to 50%. Do half and half until you really can get there. It's hard to do that. I promise you, though, if you can get there, you're going to see remarkable changes in your health anyways. Your poop is going to be great, your skin is going to be gorgeous, you're going to sleep better, and you're going to lose a little weight. Okay, good. Any questions about eating less? Any questions about eating less? Now, I will say that weight is the most important determining factor in risk of recurrence with breast. It's significant in risk of recurrence with ovarian. It's the most important risk factor in colorectal, besides smoking. And it's the most important risk factor in prostate. So we think of weight as benign. And all of us are carrying a little bit more weight than we could, except for maybe the gentleman who's using the camera right here, right? The rest of us, oh, and then my lovely lady in the jean jacket, right? But the rest of us probably could afford and our estheticians, of course, that's why they're in the front. But the rest of us could always afford to lose a little bit. The best place to be is towards the lower end of BMI, and that's so hard. It's especially hard if we've already gone through menopause, right? Because hormones have changed. And it's even harder if we're on estrogen withdrawal therapy or we're on hormonal therapy that's changed the way our body uses hormones. So that's something that we do in our clinic to help you get there. That's not something that's easy to do on your own. It's not really about calories in those cases. It's really about how you're eating, and we look at a comprehensive lab draw to see how you're using nutrients, all of which is covered by your insurance, okay? But going back a bit, any questions about portion control before I move on from diet, or diet questions at all? So Denise wanted top 5, and so did Shirley. I want you to try to eat a little less. I want you to eat mostly fruits and vegetables, and I want you to eat real foods when you have a choice, okay? As real as you can get them. Now, if we were all doing that, we would do much better than what we're doing now, right? But we are, to some extent, handcuffed by how our government regulates soil production, food production, quality of the environment, quality of our water, quality of our air. So I want you guys to think about what you can control. You can't control what the government does, but you can control your home environment, okay? You can control your home environment. Now this may seem extreme, but I don't have carpets in my home, for example. I use like a jute rug or a natural fiber rug, which you can get from IKEA. The paint on my walls is no VOC paint, meaning it does not have any volatile organic compounds in it. Paint off gases for 15 years and is a risk factor for lymphoma, leukemia, and other types of cancer like lung.
Excuse me,
Yes.
what kind of paint do you use?
No VOC, and you can paint over your walls with a no VOC paint. It's not much more expensive than a gallon of regular paint, and all the paint brands make it. Sherwin-Williams, Behr, whatever you get. You just ask for a no VOC paint. It smells like almonds. It's completely non-toxic. I use an air filter in my bedroom at night. And I use an air filter in my bedroom at night because that's when you're doing most of your deep breathing, right? So the quality of air in your bedroom is very, very important. Now, I use plants in my home that are known to clean the air. So peace lilies are important. Ferns are important. There's a beautiful video. Am I in the right place? There's a beautiful video on TED TV called How to Grow Fresh Air. And it tells you the 4 plants that you can buy, which are very inexpensive, that will completely renovate the air quality in your home. These may sound like benign things to do or simple things to do. They're so effective when you're doing all of them. And it's something you can control. The air quality in your home is something you can control. Does that make sense to everybody? I don't use chemicals in my home. So for cleaning products, we use lemon-based or lavender-based or vinegar-based formulas. What else can I think of? Air quality, water quality. For water quality, we use a filter. Now, a Brita filter is fine. It's not the best filter you can buy, but I'm a little on the cheaper side. So I use a Brita. But you guys can use something as long as you're using an air filter. You shouldn't be buying water. When you buy water, you're buying something that's processed. Water is fine, just make sure it's filtered, especially if you're buying water in plastic bottles. Now, this is not a criticism of Margot's. I think they're so conscientious. But plastic is leaching into this water, and this plastic is an estrogen mimic. So it mimics estrogen in your body, and if you're on an estrogen withdrawal therapy or you've had breast cancer, this is a no-no for you, okay? Just a regular old cup of water that's been run through a filter in a glass cup is all you really need. Yeah, and it's things we don't think about, right? It's things we don't think about. Okay, good. So, yes, my friend, what was your name?
Dawn,
Dawn.
I have a question. I have a college student and that's all he drinks. He drinks a lot of water, so that's his only option at the college. So is there something that is made with a better bottle?
It's not his only option, first of all, Don. He could get a water bottle. And he could fill it, they have water fountains. And that water is actually safer for him than the water that's in the plastic bottles.
Okay.
But yes, he can buy a better bottle. So if I can squeeze this easily, it's not as healthy for me. If it's harder for me to squeeze, it's a better plastic. And if you look at the bottom, it'll tell you, it doesn't on these because they came in a case, but the case will tell you if they're safe or not and how much plastic they're leaching. And it'll tell you that by giving you a number on the bottom. So in this country, all plastics have to be labeled with a number on the bottom. And you can Google that number and it'll tell you to what extent it's leaching plastic into the water. Now for your boy, the bigger risk is prostate cancer later in life. Plastic is not a huge risk factor for men the way it is for women because it's a hormone disruptor for women. But for men, prostate cancer is a bigger issue. So if your boy can avoid smoking, and if he can stay sporty and athletic, and if he can stay happy and healthy in terms of his intimacy and his life around him, meaning lots of laughter, lots of intimacy, safe sex of course, we can avoid the bigger issues, which are prostate, colorectal, and lung for men. Okay?
Thank you.
Good question. Any other questions? So everybody tells us to exercise, right? And we don't always get to it. We're tired, we don't feel like it, etc., right? Exercise is one of the most important things we can do to lower our risk of recurrence. And all you really need is 30 minutes, 5 days a week. So 150 minutes. And it doesn't have to be 5 days a week. It can be an hour and then you skip a day. So it has to be 150 minutes total. All of the data across the board shows that this amount of exercise is helpful. Now it needs to be slightly vigorous. So I'm talking to Anne Marie on my phone and I can talk to her, but I'm a little breathy. That would be how vigorous it has to be. Not something where you're really sweating profusely or you can't feel your feet afterwards. Just something where I'm talking on the phone and I'm walking kind of fast and I'm a little breathless. Does that make sense? So a fast walk, okay? Or a moderate bicycle ride or even just walking in water, okay? Any questions about type of exercise, what to do if you can't exercise well? Any questions about that? How about timing? What are people's reasons for not exercising? How about that? What are people's reasons for, is everybody here exercising?
There's many reasons, I think.
What are your reasons, Ursula?
Well, I have several I could use, but I know some of the bogus ones are you don't have time.
So you don't have time, okay?
The real reason is sometimes I just don't want to.
You don't want to,
The real reason, not the
right.
bogus reason. But a lot of people say they don't have time, and that's, I think that's
And
a
they don't
big
feel
excuse.
like it, yeah?
And they don't feel like it.
Uh-huh, okay. Anybody else? It's too cold outside? Okay, good. Anything else? Any other reasons?
Rationalize and say we've walked all day at work, that counts.
Yes. So what about that? We've been active all day at work. Does that count? So being active at work actually does help you prevent heart disease, but not cancer. So moving, if you move around, so if you're walking at work, you're on your feet, it does help you to prevent heart disease because you are moving. And when we move, we take less pressure off the pump, we're forcing the lymphatic system to move, we're putting pressure on the vessels and increasing our venous pump. But it doesn't do anything for cancer prevention, okay? For some reason, the data shows us that we have to be fast walking or doing something that raises the heart rate for a full 30 minutes, 5 days a week. And in breast cancer, it lowers the risk of recurrence by 50%, which is the same data for aromatase inhibitors or estrogen withdrawal therapy. We also see a significant reduction in recurrence when we lose weight, and when we exercise, we're losing a little bit of weight. Why would that be? Does anybody have a clue as to why losing weight would help us to fight recurrence? Yes.
Lowers hormones.
What was your name again?
Cindy.
Cindy. Cindy had a point. How about lowering hormones? Now that's almost right. Our adipose tissue, so our fat tissue, is actually storing things like hormones, but also pesticides and other environmental chemicals. When we lose weight, we lose those chemicals. We dump them in our stool and in our urine. Also, our adipose tissue, our fat tissue, upregulates hormones. That's what you meant, Cindy. And by upregulating hormones, we increase our risk of hormone-related cancers. Now, for some people who have lung cancer, pancreatic cancer, weight maintenance is very important. So if you're currently in treatment, you should not be dieting, you should not be trying to lose weight. But if you're not in treatment right now and you're trying to lower your risk of cancer, you want to stay towards the lower end of BMI if possible. Now, I'm not a great example, but partly so the reason I got this heel fracture is I did a boot camp to lose weight. I lost 17 pounds and then I broke my foot. So back to square one, but I'm determined. Okay, any questions about exercise? Top 5 is actually not about nutrition and not about exercise, it's about spiritual outlook. So, spiritual outlook is so critical in lowering risk of recurrence. Support groups like the one Lynn is involved in are beautiful, but when you're surrounded by people who may be talking a lot about their challenges, sometimes it changes the way you think about the world around you. It's like the filter you're seeing the world through. And for most of us who have dealt with cancer, that it becomes part of our filter at looking at the world. How we look at the world changes the way your cells, particularly your immune system, responds to the world around you. In fact, there's more data on positivity and prognosis in cancer than there is on any other therapy besides chemotherapy. There's more data on positivity. So we actually know that our outlook actually does have an impact on prognosis and a more impactful impact than anything else we do. So what are ways to stay positive? One of the things we tend to do when we're struggling with cancer is isolate. Isolation is one of the most dangerous things we can do as social creatures. So it's very important to be connected to others. Just being here tonight is part of that, right? You're sitting close to somebody you don't know. You're sharing in a vision or an idea or a challenge or a trip, a journey that you wouldn't share with this person if you were sitting on a bus, right? You're helping each other with your coffee and your food, and you're encouraging each other as you ask questions. That's socializing. That social environment actually changes the way your immune system responds to the world around you. So even though it's cold, I want you out there. I want you doing things. Get on Eventbrite and look for things that you might be interested in. Get on Meetup and look for things you might be interested in. Eventbrite is a website.
I was going to say, what is
Eventbrite, E-V-E-N-T, event,
E-V?
like an event that you go to. Bright, as in B-R-I-T-E, not B-R-I-H, B-R-I-T-E. It's a website where you can just put in like art, Detroit, or art, Birmingham, and a date, and it'll tell you all the art events, or all the lectures, or all the dances, or all the galas, or whatever. You know, whatever you're interested in doing, whatever you're interested in going to. And you can show up if you feel like it.
What was it, Eventbrite, and the second one?
Meetup.
Meetup.
Meetup. Meetup is a way to do that with people that you might like to be around.
Okay.
But it's not a dating thing. It's just about, you could put it Meetup and put cancer, and you'll see hundreds of support groups. You could put in Meetup in knitting, Meetup in book lovers, Meetup in anything. Okay?
Okay.
Another important piece of spiritual outlook is not just isolation but intimacy. So a lot of doctors don't talk about intimacy, and intimacy is critical. I talk to so many couples where they get to a place in their marriage where they just don't have that intimacy anymore. Or maybe we're living alone and it's hard for us to figure out what does that even mean for me anymore. Intimacy can mean having a pet. It can mean gardening. It can mean being skilled in self-touch. It can mean seeing a massage therapist or an esthetician. Any sort of physical touch is intimacy, okay? And physical touch changes the way your cells respond to the world around you. Now these may seem like soft things, they may seem not impactful. There's a website called pubmed.gov, 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 G-O-V. That is where the government publishes all clinical data done anywhere in the world at any time about anything. It's available to you as a taxpayer. And when you go in there, I want you to put in something like mind, body, or mindfulness and cancer. And then it'll list all of the clinical trials that have been done on that topic. If you click on the top left, it'll select for human trials. You will see so much data, and then you'll understand how impactful this is.